the United States is celebrating its first inaugural Children's Environmental Health Day on October 13th. Observers say it's an opportunity to bring forth the impact of climate change on people's health and children in particular. The U.S. Environmental Protection Agency says rising temperatures may decrease air quality by increasing the formation of ground-level ozone. Ozone exposure may lead to a number of adverse health effects in children, such as a shortness of breath, chest pain when inhaling deeply, wheezing and coughing, temporary decreases in lung function, and lower respiratory tract infections. The Allergy and Asthma Network and Mom's Clean Air Fund is announcing a partnership to promote an educational initiative on the connection between climate change and asthma. For more on the subject, we have two guests with us today. Molly Roach is the Public Policy Director of Mom's Clean Air Force. Also joining us is Charmaine Anderson, Director of Advocacy, Allergy and Asthma Network. Ladies, welcome to Africa 54.
Thank you.
So simply put, what is climate change? We hear about climate change, but how can we simplify it and understand it?
So because of human activity, we have dramatically rising levels of carbon dioxide and other heat-trapping gases in our atmosphere. And what that's doing is that's increasing global average temperatures, it's melting ice sheets and raising sea levels around the world. And that's leading to health impacts right now and predicted health impacts in the future.
And now you are looking at specifically children's, at least for this special partnership that you've signed between both organizations. Tell us about the effect of climate change on children's health, especially when it comes to asthma.
So Mom's Clean Air Force and Allergy and Asthma Network, we're very concerned about asthma. Asthma is a huge problem. In the U.S., there are more than 6 million children with the disease. That's more than 8% of all children, and in some urban areas, it's as high as 15% or higher of all children. So this is a major health threat to children, and climate change is having complex processes on our ecology and our environment, but many of those things that climate change is doing to our environment, those things are increasing asthma triggers. So for example, heat waves, we know that climate change is increasing the severity and frequency of heat waves. Well, heat is an asthma trigger for people who have asthma. Same with forest fires. Climate change can increase the frequency and severity of fires in certain areas of the world. And the smoke that comes from forest fires, that can travel hundreds of miles. And when it's inhaled into the lungs, that can trigger symptoms in people who have asthma.
Okay, and Charmaine, let me come to you. Now, as a mom, of course, it's something to be concerned with. Now, people talk about climate change and doing something about it. What is done here in the United States on the federal level that perhaps can be replicated in other countries?
Well, I think, and just to say, not only am I a mom, but I'm also one who does have asthma, as well as children who have asthma. So as we look at the federal level, some of the policies and proposals that are in place or that members of Congress and our administration are working on deal with, particularly from an air standpoint, where we're talking about renewable energy, where we're talking about bringing in wind and solar power to help with our electricity grids. In addition to with biomass is another issue that's being discussed at the federal level in regards to whether do we, able to burn biomass and able to utilize that as a source of electricity. And then also, as Molly mentioned, when we're talking about extreme weather patterns and we're talking about drought, even states like California who are dealing with, large issues as far as drought, and when you're dealing with just the dust and the particles that travel, and really, as a state, really, how are they looking to do things to combat the kind of the secondary issues of climate change?
And the effect of climate change is definitely a global issue that people have talked about. So how can individuals influence lawmakers, whether it's in the United States and even in other countries?
So climate change is a big issue. So individual actions are important at your home and community level, but we feel very strongly that climate change has to be addressed at the large scale, and that takes political involvement and engagement. So at Mom's Clean Air Force, we help moms across the country learn about the issue and then help them connect with their lawmakers and policymakers, simply to say that they have a stake in this issue as parents, as families, and they want to see solutions. So moms want to see solutions. There are solutions available. We need to create the political will for that to happen.
And speaking of solutions, how can people be part of the solutions, whether they're patients, family, physicians, educators? Charmaine, what can you tell us in terms of small actions that people can take?
Absolutely. So first and foremost, even from us as a patient advocacy organization, our goal is to educate the folks that we are representing, those that have asthma and allergies, from the sense of just really what is climate change. How, again, like you mentioned, how can you be impactful in your communities, in your schools, and whether that's, looking for ways to be more energy efficient, looking for ways to curb just, your transportation modes as far as carbon emissions into the atmosphere, and finding other alternative modes of transportation like transit options. Okay. But more importantly, just to helping them engage with their local lawmakers, and really kind of bringing those issues to the forefront locally in their communities with their state and county representatives, where it can then transpose itself at the federal level.
Okay, thank you so much. We have to leave it there, ladies. Thank you for coming today.
Thank you.
Thank you.
And that was Molly Raj, Public Policy Director of Moms Clean Air Force, and Charmaine Anderson, Director of Advocacy, Allergy and Asthma Network.